Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, intraocular lens. Intraocular lens are mainly placed in the posterior chamber, and these intraocular lens are of two types. One, we have non-foldable lens which are called which are made up of polymethyl methacrylate, and we have foldable lens which are made up of hydrogel, silicone and acrylic contains foldable intraocular lens. So these are mainly the posterior chamber intraocular lens. So if you see the intraocular lens, the parts of the intraocular lens contains an optic and the haptic. This is haptic loop and this is haptic angle, and the overall diameter is the one which we see. Now, even we also have anterior chamber intraocular lens are also present, though not used commonly. So anterior chamber intraocular lens, what are the examples of anterior chamber intraocular lens? We have Kalman multiflex lens, or we also have iris supported burst or Singh's iris claw lens are seen. So we have Kerman's multiflex, iris supported bursts and Singh's iris claw are seen as intraocular lens.
thank you and thank you for watching.